Do you spend more time counting sheep than actually sleeping? Have you tried everything from warm milk to sleep masks, but still find yourself tossing and turning all night? If you're struggling with insomnia, keep watching. In this video, we'll explore an effective solution called cognitive behavioral therapy for insomnia, or CBTI. What is insomnia? First things first, what exactly is insomnia? Put simply, it's a sleep disorder where you have trouble falling asleep or staying asleep, even when you have the chance to sleep. Insomnia can involve difficulty falling asleep at bedtime, waking up frequently in the night, waking up earlier than desired, and being unable to fall back asleep. Insomnia is prevalent. An estimated 10 to 30% of adults deal with chronic insomnia, while up to half experience occasional bouts. Lack of sleep takes a major toll, affecting your mood, energy, productivity, work performance, relationships, you name it. Insomnia is no joke. Common treatments. Many people rely on sleeping pills to combat insomnia. While these might provide temporary relief, they often lose effectiveness over time and don't treat the root causes. Others try natural remedies with limited success. It introduces CBT, which brings us to cognitive behavioral therapy for insomnia. CBT has become the first-line treatment used by sleep experts. Rather than just masking symptoms, CBT aims to improve sleep by targeting thoughts and behaviors that negatively impact sleep. What is cognitive behavioral therapy for insomnia? To break it down, cognitive behavioral therapy for insomnia, or CBT, combines various research-backed strategies to help reboot your sleep cycle. These include sleep restriction, limiting time spent in bed to match actual sleep ability; stimulus control, associating bed only with sleep; improving sleep habits and environment. Cognitive therapy addresses worries and thoughts that interfere with sleep. Relaxation techniques, ways to calm your body and mind before bed. CBT helps you identify and change habits, thoughts, behaviors, or even your environment that are hurting your ability to sleep. Taking a comprehensive approach sets the stage for lasting improvements rather than quick fixes. Who can benefit from CBTI? CBT can benefit anyone with insomnia, whether you're a night owl struggling to sync with daytime norms, someone with anxiety whose thoughts race at night, dealing with chronic pain disrupting your sleep, suffering from long-term sleep loss, having trouble getting restful sleep. CBT can also help those with medical, psychiatric, or sleep disorders contributing to insomnia. The CBTI process. If you decide to pursue CBTI, what should you expect? There are a few key phases. Initial consultation. Your CBTI therapist will learn about your sleep history, habits, challenges, and goals. You may get questionnaires or keep a sleep diary. This assessment helps customize your treatment plan. Personalized treatment. Your therapist will introduce specific therapies like sleep restriction, stimulus control, or cognitive restructuring, choosing techniques suited to your situation. Ongoing sessions. You'll check in regularly with your therapist to monitor progress, troubleshoot issues, and adjust your plan as needed. There's also homework to practice strategies at home. Once your sleep improves, you'll review your progress and get tips for maintaining gains long-term. Research and efficacy. Several studies underscore both the short and long-term effectiveness of CBTI for insomnia. For many people, CBTI works faster and has more lasting effects than sleep medications. Improvements can happen within weeks, with over 70% of people seeing major improvements with CBTI. One key study found that 88% of individuals who did CBT maintained better sleep quality even a year later. Current advances. Exciting developments are happening with CBTI, like expanding access through digital programs and tailoring them to treat patients with comorbid conditions like chronic pain or PTSD along with insomnia. When to seek treatment. If you've had persistent insomnia for over 3 months causing daytime dysfunction, it's time to consider treatment. Signs your insomnia requires professional help include difficulty sleeping 3+ times a week, impaired mood, focus, or performance, fatigue or low energy, increased anxiety or depression. Finding a therapist, look for a licensed therapist specializing in CBTI. Meet with a few providers before deciding to ensure you click well together. Many therapists now offer online CBTI, making this treatment more convenient through video sessions. Complementary approaches. Alongside professional therapy, some complementary remedies may help. Improving sleep environment and habits. Natural supplements like melatonin. Relaxation techniques like mindfulness, yoga, or meditation. Light therapy for circadian rhythm disorders. Discuss adding any complementary approaches with your CBTI therapist. Setbacks and maintaining gains. Ups and downs happen on the road to better sleep. Try not to get discouraged by occasional rough nights. Analyze setbacks to understand triggers and get back on track. To lock in sleep gains long-term, stick to consistent sleep and wake times. Maintain bedroom for sleep only. Continue practicing strategies learned in CBTI. Pay attention to lifestyle factors impacting sleep. Staying informed on sleep health can also help sustain improvements. Embarking on the journey, we've covered a lot of ground, laying out the basics of cognitive behavioral therapy for insomnia, from what it is to why it works, who it can help, and how the treatment process flows. Hopefully, you now better understand CBTI and are empowered to consider it as an option if you're living with insomnia. As many satisfied patients will attest, CBTI can be life-changing, finally providing a pathway to restful nights and brighter days ahead. Commit to prioritizing your sleep health just as you would your diet or exercise. Before we go, make sure to like, share, and subscribe to our channel. Thank you and sweet dreams.